So, your practitioner just gave you Pristiq. Is it going to actually help or just make things feel more numb? If that sounds familiar, you're not alone. Starting a new medication always feels like a leap into the unknown. Here's the real story. Pristiq can be life-changing for the right person, but it's not a slam dunk for everyone. I'm Dr. David Danish, a double board certified psychiatrist. I've treated over 100,000 patients and I have prescribed Pristiq a lot. So let me walk you through what actually happens in real life, what works, what's tricky, and what to really watch for. Pristiq is what we call an SNRI. That stands for serotonin norepinephrine reuptake inhibitor. In plain English, it means it boosts serotonin, which helps regulate mood, anxiety, and sleep, as well as norepinephrine, which affects energy, focus, and motivation. Pristiq is currently approved for major depressive disorder in adults, but it has many off-label uses. These aren't officially approved, but psychiatrists and other practitioners, including myself, often use Pristiq when the research supports it, even if it's not FDA approved. Some of the many off-label uses include anxiety disorders, ADHD, perimenopausal mood issues such as premenstrual mood disorder, and chronic fatigue or brain fog, when other medications like stimulants in ADHD or SSRIs did not work or were not a great fit. So who does it work for? For depression, study shows that about 1 in 3 to 1 in 2 people get at least a 50% reduction in symptoms by week 6 to 8. Some people notice better sleep, improved energy, less irritability, less mood swings, even in the first 1 to 2 weeks. But the real mood shift usually hits between weeks 3 and 6, with benefits all the way out to 12 weeks after that first dose. I've had patients say, I didn't feel drugged. I just felt like I could finally breathe again. In other words, it's not making them feel overly numb or not like themselves. It just takes the edge down. All right, let's get into the side effects because this is the part most people worry about, and rightfully so. Here's how I break it down with my own patients. In about 15 to 25% of people, we're gonna look for nausea, loose stools, mild dizziness, a little feeling wiped out, mild headaches, and dry mouth. The good news is that these usually fade within the first 1 to 2 weeks as your body adjusts. The side effects that can sometimes stick around long-term that I watch for, sexual side effects or lower libido, delayed orgasm, show up in about 10 to 25% of patients. It's usually a lot less common than other medications in its class and less common than SSRIs like Prozac and Lexapro, but it's still possible. Increased sweating, I have seen that in some of my patients, and some of my patients have complained of mild increases in irritability. At the same time, they're stating that their anxiety and depression are not as bad, but that usually is not a great fit in my opinion. Okay, immediately call your provider if you feel more anxious, more emotionally out of control, easily agitated, irritable, or impulsive, or if you're having dark or intrusive thoughts such as suicidal thinking. These are not signs that you should stick with it longer and just wait to see if they get better. Please reach out to your practitioner right away, and if you cannot reach them, consider stopping the medication until they can get back in touch with you, hopefully soon. Okay. Those rare kind of 1 in 100, 1 in 1,000 side effects. There's the serotonin syndrome if you combine it with too many other medications and or supplements that work on serotonin. The random allergic reactions such as those that cause a rash or even, God forbid, trouble breathing where your throat starts closing up. Pristiq is not known to do that any more than any other medication out there, but we still need to look for those potential side effects. Pristiq, being in the SNRI class, can lead to some higher blood pressure in some patients, especially at doses at 75 milligrams or higher. This can be about 1 in 50 people. At 200 milligrams, it's about 10% of people. Hyponatremia, low sodium, is possible, so we need to be a little bit worried about that, especially in older adults. And also in older adults, we need to watch for bone density concerns, which is also true with other antidepressants in this class and the SSRIs. For patients under the age of 25, there is our black box warning for any antidepressant, and that's true for Pristiq. So less than 1 in 132 people under the age of 25 who go on an antidepressant will have an increase in suicidal impulses and thoughts, and that's a side effect that means it's not the right fit for them. It's very rare, but it just means that the medicine is not working well with their system and it needs to be stopped immediately. Dose ranges and formulations. Pristiq comes in 25 milligram, 50 milligram, and 100 milligram tablets. Most people start and stay at 50 milligrams, although I usually start my patients at 25 milligrams and then get up to 50 milligrams. Some say you don't have to ramp up gradually, but I've noticed that my patients tend to respond better and with less side effects if we do. The maximum dose range goes up to 200 milligrams in rare cases. Most people do take it in the morning because it can be a little bit activating. That can be good for energy, motivation, and off-label benefits for ADHD as well. So here's my take on it. After prescribing this medication to thousands of patients, I've grown to really like it for most of them. It's actually one of my favorite SNRIs to start with. Why? Because on average, it actually has less weight gain than many other antidepressants, including SSRIs. It has fewer sexual side effects than SSRIs and its brothers and sisters in the SNRI group. And it has almost no medication interactions. It is not affected by variations in how you break down medications in your liver. That's rare with any medication in psychiatry. It's also very beneficial for people with ADHD, so those who either have failed stimulants or the stimulants are on board and not quite doing enough, this can add a little boost that people really do like. But as is true with every medicine, Pristiq is not for everyone. I would say about 1 in 5 people just don't tolerate it very well. They might feel nauseated, emotionally off, or just irritable in a way that's sometimes sort of hard to pinpoint. It just is not the right fit for them. That's why I tell people, this one's usually a fast yes or a fast no. We'll know within 1 to 2 weeks if it's a fast no. Also, Pristiq used to be super pricey. That's improved a lot with it becoming generic, but it still may cost more than some other medications in its class, like Effexor or Cymbalta, depending on your insurance. And remember, starting a medication like Pristiq might feel intimidating. It does for many. But for a lot of people, it's a turning point. You're not alone and you're not stuck. Here's what to do next if you're starting or just curious about Pristiq. Head to drdaviddanish.com and check out my Mind Vault. If this helped, give it a like or subscribe, and please send it to someone else starting this medication or considering the choice of Pristiq. It might make a big difference for them.